So, hi everybody. It's so nice to see all of you. I hope you're all having a great summer. I'm really excited to kick off our Measure Set Review or MSR activities for this cycle with you today. My name is Meredith Eastman, and I am the Pre-Rulemaking Measure Review and Measure Set Review Task Lead at Patel. And I'm joined today by several of my colleagues, as well as our CMS task lead. And we are thrilled to welcome you to the MSR committee and to meet with you to talk about what to expect this cycle. So we can move on to the next slide. Again, thank you so much for joining us today. We have officially published the MSR roster, which you are all on our website. And so we're following as soon as we can with this meeting to kind of kick things off for you. And we really appreciate your time and your energy and your attention in today's meeting. We can move to the next slide. I have just a couple of housekeeping reminders before we get started. We do invite you to type in the chat or raise your hand at any time, and we'll call on you to unmute. If you do experience any technical difficulties, you can reach us via email at pqmsupport@battelle.org. We do have folks monitoring that mailbox to assist if you run into any technical difficulties during this call. And we can move to the next slide. So this is what the Zoom interface looks like on a mobile device if you're joining on your phone. If you're joining on your desktop or laptop and want to raise your hand, you'll see the large React button at the bottom of the screen. It's got a heart. Once you click that, you'll see options for raising your hand or sharing other reactions. So feel free to use that button, raise your hand, react in other ways as we continue our time together today. We can move to the next slide. So our objectives for today are on this slide. We're aiming to provide an overview of the Measure Set Review process and the evaluation criteria. We'll describe expectations for your engagement as committee members and hopefully prepare you for upcoming milestones and activities. We can move to the next slide. So these are the topics we hope to cover today. We'll hear some opening remarks from Mel Gross at CMS. I'll provide a brief overview of the Partnership for Quality Measurement, and then we'll get into the specifics of Measure Set Review, discussing the overall MSR process and our evaluation criteria. Then we'll talk about what to expect at the MSR recommendation group meeting in October and the timelines leading up to and following that meeting. I will also give a brief tour of our website and the committee workspace towards the end. We do hope to have time for questions at the end, but I'm actually going to encourage you to ask questions as we go. So again, feel free to raise your hand or use the chat at any time. And let's move to one more slide there. So as you are all very well aware, we use a lot of acronyms. And here are some of the acronyms you're likely to hear today. But if at any time you hear something that you don't understand, we do encourage you to ask for clarification. Additionally, we have a glossary on our website that's linked in the chat that you can access to get yourself more familiar with the terminology we use and any sort of mysterious acronyms you may hear today. We can move on to the next slide. Wait, so before we dive into the content today, I'd just like to turn to Melissa Gross, the Primer MSR Task Lead at CMS, for her opening and welcoming remarks.
Hi there, everyone. My name is Melissa Gross. I usually go by Mel. I also want to share in giving you a warm welcome. We're so happy that you're joining this process. And the goal is for you all to give us meaningful recommendations about the measures that you review. So if you are new to the process, please ask questions, make sure that you feel familiar with the process and that you're comfortable so that when we do get to those recommendation meetings, that you feel prepared to make a recommendation. Otherwise, For those that have been here before, welcome back. Happy to see you. And I look forward to working with all of you. Thank you so much. Back to you, Meredith.
Thank you so much, Mel. And I agree. Please ask the questions you need to ask to help us prepare you for your recommendations. So I'm going to just talk a little bit about the Partnership for Quality Measurement overall, and we can move to the next slide. So Battelle is a consensus-based entity funded through the CMS National Consensus Development and Strategic Planning for Healthcare Quality Measurement Contract. And we oversee the endorsement and maintenance of clinical quality measures, as well as the engagement of interested parties in the CMS pre-rulemaking and measure set review processes. The overarching PQM vision is that measure reviews should be reliable, transparent, attainable, balanced, and meaningful. And the graphic on the left here shows the three main areas of PQM's work. So we have primer, we have MSR, and we have E&M, or endorsement and maintenance. Each of these areas has their own scope and focus. The primer process, you are all also on primer committees. That process allows PQM committee members to weigh in on measures under consideration for use in CMS programs, whereas MSR, what we're talking about today, allows committees to weigh in on the continuation of measures that are currently and already in use. The other major activity that is conducted under PQM is endorsement and maintenance, and I know that some of you also work in that space as well. That process allows Battelle to endorse quality measures regardless of their intended use. So you'll see some arrows connecting E&M with primer and MSR. E&M endorsement contributes to the understanding of the meaningfulness criterion, specifically in primer and MSR. We'll talk about meaningfulness a little bit later on today. And primer and MSR also inform the usability criterion in endorsement and maintenance. So there are some connections across all of these processes. We can move to the next slide. So just to reiterate, actually, this slide shows the evaluation focus and criteria for each of those three processes that I showed on the previous slide. So you can see how they align and the distinctions between them. But basically, primer considers how well a measure could fit and perform in a program. MSR considers how well measures continue to fit and perform within a program, and E&M considers how credible a measure is regardless of program use. Next slide, please. So we are gathering you all for the purpose of coming to consensus-based recommendations about whether measures in quality reporting and value-based programs should continue to be used based on the evaluation criteria of meaningfulness, data stream burden reduction, and relevance to the patient healthcare journey. And we'll talk about these three evaluation criteria in more detail later today. Can move to the next slide. So we have a guidebook that outlines our policies and procedures, and we update it annually. We do invite review and public comments on proposed changes that happened earlier on in the summer, and the final version is currently posted on our website. There are some updates that will affect our work in MSR this year, so I want to highlight those here. So first, just from an administrative perspective, we've really tried to emphasize and streamline our disclosure of interest requirements. So you are each asked to complete a general DOI form annually. That form is now available in Microsoft Forms, and we've just put a link to that form in the chat. The annual disclosure of interest will also cover your participation in primer, so that you just have to do that once a year. If you haven't completed it yet for this year, go ahead and take a moment later on today to fill out that form that's in the chat. In addition to that general DOI that we've just put in the chat, closer to the MSR recommendations meeting, we'll also ask you to complete a separate disclosure of interest form that is specific to the measures we'll be reviewing. That will also be in Microsoft Forms, and we'll send the link to that DOI closer to the recommendations meeting. So our next update is related to the identification and selection process for MSR. So specifically, we worked with CMS to make a preliminary selection of 39 measures for this year's MSR cycle. For each one of these measures, we developed a brief performance and impact analysis, PIA, PIA, pronounced as PIA. And that is based on performance data and publicly available information in CMIT. We posted those PIAs for public comment, and we used that information to work with CMS to select our final set of 35 measures for review. So we'll be reviewing 35 measures this year as part of our MSR process. Lastly, the guidebook includes some updates that we've made to the PQM website. So specifically, we now have an MSR measures page where we'll display preliminary assessments, collect public comments, and PI forms for each measure. And that uses a tabbed format very similar to what we launched in Primer last year. So if you worked through the PAs on the website last year, that will look very familiar to you. If you visit our MSR measures page now, you will see the PIAs for the preliminary selection of the 39 measures. So you're welcome to take a look at that at your leisure. And we also have some committee workspace enhancements on the website in progress, and I'll talk you through what that's going to look like at the end of today's meeting. We can move to the next slide. Something else that's new this year is we're adding to our process to ensure that you all are prepared for the recommendations meeting and you've been able to engage with our education materials. So we're just shoring up the requirement of attending this meeting. So if you're here, you get a gold star. Nothing more you need to do. However, we will be following up with your fellow committee members who were unable to attend today. We'll be sharing the recording of this meeting and asking them to attest to viewing it once we provide that recording. So that's just to make sure that everyone is on the same page and to give everyone the chance to ask questions and get the clarifications they need. We can move to the next slide. So the next few slides cover some basics about MSR and the focus of measures we're going to be reviewing this year. Each of you are here today because you are on the MSR recommendation group. You are also seated on a primer committee, could be PAC LTC, hospital, or clinician, on the advisory group or the recommendation group for those setting specific primer committees. We selected you to serve on MSR from across these committees to bring together a group of 25 to 30 voices with representation across those settings, specific committees. And the MSR commitment is just a one-year appointment. So the MSR committee next year will look different from what it is this year. We can move to the next slide. And again, you've been selected from across our primer setting specific committees to ensure that we have a broad range of voices participating in the MSR process. Next slide, please. So as part of our measure set review efforts as the CBE, it's our goal to strategically consider all measures in the CMS portfolio over our 5-year period. And we do that using the cascade of meaningful measures. The cascade of meaningful measures is based on the 8 healthcare priorities of Meaningful Measures 2.0, and it's a framework that helps prioritize existing healthcare quality measures, align or reduce measures where there are too many, and identify measurement gaps. We have provided a link to to more information about the cascade in the chat. And we can move to the next slide. So we've divided the portfolio into 4 groups or cycles that you'll see on this slide based on the cascade of meaningful measures. And so you can see that red box is around year 4. We're in cycle B, which is safety and healthcare delivery. And so all of the measures we're going to be talking about this year are from the safety priority of the cascade of meaningful measures. You can move to the next slide. So that's kind of how we structured MSR sort of broadly across sort of the 5-year span of work using the cascade. But now I'm going to talk a little bit more about the specifics of the process and how the process leads to recommendations on continued use of quality measures. Let's go to the next slide. So as we're showing on this slide, there are 3 major steps that comprise the MSR process: measure identification, analysis and feedback, and discussion and recommendations. All of these steps support the purpose of MSR to optimize the CMS measure portfolio via review of measures for continued use. Next slide, please. So we were just discussing how we have our 5-year schedule for measure reviews. We do revisit this schedule annually with CMS to ensure continued alignment with CMS's needs and priorities. And again, this year we are focused on safety in terms of the cascade of meaningful measures. CMS collaborates with us to select up to 50 measures that fall into the selected cascade priority. This year, there were 39 measures in that initial set. And for each one of those measures, we developed the PIA, the performance and impact analysis, and posted those for public comment earlier in the summer. Next slide, please. Following that public comment period, we worked with CMS to select up to 35 measures from that initial set, taking into account the public comments we received on the PIAs, any measure duplication or overlap within the programs, and other strategic priorities. So we selected the 35. I know it says up to 35. We are at the cap of 35 with our measures for review this year. And we can move to the next slide. So once we have that final set of measures, which we now do, we enter the analysis and feedback stage with the creation of our preliminary assessments, or PAs. We review and analyze recent performance data. We pull information from CMIT, the STAR database, and also Merit when that's relevant. And we post these preliminary assessments on the website in our new tabbed measure display for the public and for you all to review. So again, those will be on the MSR measures page in the tabbed measure display, similar to what they looked like for primer last year. So we can move to the next slide. Thank you. So as part of the PA creation process, we reach out to measure stewards, including CMS, to ensure accuracy of the information that we put in those PAs. When we publish the PAs, that really kicks off what we call our pre-meeting initial evaluation, or PI data collection effort. This is where you will use the measure and performance information in the PA to provide your thoughts on the evaluation of the measure according to the MSR evaluation criteria. This written feedback, which is provided on our website, helps get a sense of where greatest disagreement lies among the committee so that we can prioritize those areas when we meet for the recommendations meeting later in the fall. We include summaries of the PI information in our meeting materials to help facilitate the recommendation meeting. We can move to the next slide. So this is our last step. It's the discussion and recommendation step. This year's MSR recommendation meeting will be held virtually across 3 days in October. The discussion will prioritize areas of greatest disagreement based on the public comments we receive and on those PI results. There is kind of a general flow for the measure discussion that we'll dig into in a little more detail later in today's discussion. But essentially, for each measure, The TEL facilitators provide a review of the measure, including public comments and the PI results. And then we turn it to CMS, who provides a brief overview with some important contextual background on the measure. And they also discuss the rationale for continuing or not continuing the measure. And then we turn things over to you all for discussion. Once we sort of feel like we have reached a point of approaching consensus, we will then move to vote, and you will vote on your recommendation. Next slide, please. So we collect all of the final recommendations in the voting software, and we use that to create a summary recommendation spreadsheet, which then gets posted for a second public comment period at the end of the MSR process. The intent of that second public comment opportunity is just to gather additional feedback on the measures for CMS. The recommendations and public comments do not change the recommendations themselves. So let me pause there to see if folks have any questions on the process. I do see that we are working on updating the DOI link so that it works for everybody. But let me just pause for a minute to see if there are any hand raises, any questions so far. Okay, great. Well, I am not seeing anything. If something comes up, please feel free to raise your hand or use the chat, and we can move to the next slide. And having completed that overview of the MSR process, I think we are ready to talk about the evaluation criteria. So I will hand it over to my colleague, Lydia Stewart-Arts. Take it away, Lydia.
Thank you, Meredith. Good afternoon, everyone. I spoke with all of you, many of you, at our last committee member meeting, at which point we went over our evaluation criteria in a lot of detail. So today will just be a reminder. We'll talk about PI forms and kind of your homework assignments as we prepare for MSR. And as always, if you have any questions, feel free to raise a hand or put it in the chat. Next slide, please. Okay, so as a reminder, MSR measures currently in use, right? We want to make sure that the measures are still appropriate for the populations, programs, data sources, et cetera, that are available within programs. To do that, we have 3 criteria. The first criterion is that of meaningfulness. That is kind of the box in which we have all the criteria we're familiar with: feasibility, validity, et cetera. We'll talk about that. The second criterion is that of data stream burden reduction. And then the third is alignment with the patient healthcare journey. So just as a reminder, that's our roadmap. That's where we're going. 3 pillars of evaluation. Let's dive a little bit more into that kind of first box of meaningfulness. Within this criterion, we are looking at 6 key sub-criteria, the first of which is importance. So key questions here is, does this measure still focus on an outcome that matters or on known gaps of care? So we know when a measure was proposed in rulemaking, it was important, it was relevant, it was in line with current clinical evidence, but a lot of these measures have been in programs for a while now, so we just want to do kind of a gut check on the evidence and the measure importance. So that's what we are covering under importance. Up next is feasibility. We are asking ourselves, are the tools, processes, and people necessary to implement and report on the measure reasonably available? They were when it was implemented in rulemaking. Is that still the case? So we have some insider knowledge because I've been working on the preliminary assessments all morning. So we have some examples where maybe we've updated how we collect data, or we've updated the types of clinical visits that patients with certain conditions undergo and experience. So is the measure still aligned in terms of feasibility that way? And then for conformance, does the measure continue to function as it was intended to when applied to current data sources, program populations, and settings? Next slide, please. For validity, we ask ourselves, does the measure score accurately reflect quality of care? And for MIPS, this would be, does the measure performance rate accurately reflect quality of care? And then are there still clear and effective ways for reporting entities to improve performance on the measure? For MSR, we do not always have validity testing data right at hand like we do for primer. Those primer measures are new and shiny, or they've been polished and given a chance to do new testing data. For MSR, we've got current measures, we've got some older testing information. Sometimes information is no longer available when it was initially put on the muck list. So for validity and reliability, we are working with our CMS colleagues and measure stewards to make sure all of the information is up to date. So our current step in this process is we are sending our draft preliminary assessments out to CMS and the measure stewards. And one of the things we're asking most of them is, has there been any ongoing work for validity and reliability testing, any updates or contextual information that the committee should know? And we'll report all of this information back to you in the preliminary assessments. For reliability, we're asking, do differences in performance reflect true differences rather than random variation or measurement error? And where we were able to, due to population, like the sample size, reporting on the measure, other programmatic constraints, where we were able to, we've done additional analysis of reliability using performance data so we can see reliability in program. We don't have that for every measure of MSR due to, like I said, some measures have very low reporting volume. We weren't able to do it, or other programmatic constraints. But when that is available, you will see it in the preliminary assessment. And then finally, usability. So does the measure provide actionable insights for improving quality of care? And then have any potential barriers to implementation or unintended consequences been identified and mitigated? And this is another section where we are very frequently putting comments in for CMS and measure stewards to give us information back. Have you heard anything? Have any challenges to implementation been reported? Are there any unintended consequences that have been identified? And we'll discuss those in detail where we are able to. Next slide, please. Our second criterion is that of data stream burden reduction, the criteria previously known as data stream parsimony, but we wanted to really emphasize the burden reduction aspect of this. When evaluating this criterion, you guys should consider whether the clinical data flow required for the measure promotes non-burdensome data collection and reporting. So for example, does the measure require any additional data workflows, separate submission mechanisms, or unique extraction processes that we could otherwise streamline or eliminate? And then when we think about the measure set as a whole, other measures within the program, this measure across similar settings, has measure set redundancy in data streams been identified and mitigated? So for example, is this measure duplicative of others in the set that assess similar gaps of care? So is there anywhere we can streamline, make providers' lives a little easier? Okay, next slide, please. Great. And then the final criterion here is that of alignment with the patient healthcare journey. And so when evaluating this, you should evaluate whether the measure remains aligned with how patients experience and prioritize care. And this is the criterion where we have the least amount of evidence to support our evaluations. We have, logical evidence about, are we asking questions at appropriate timing? Are we asking the right questions for the right time of care? But having not been a patient, undergoing all of the various conditions and surgical opportunities that we focus on in MSR, we can't directly relate to this. So if you are someone that's speaking from the patient experience as your role on this committee, we really encourage you to lean into this criterion and give us as much information as you can about whether patients in similar situations would experience prioritized care in a way that aligns with this measure. So I explained this infographic in detail on our strategy meeting. I won't go into super detail again, just to kind of save you a little bit of time. We just looked at this a month ago, but very generally, this graphic identifies what we're trying to do with this criterion and essentially say, as we move a patient from, for example, this person is undergoing a total knee replacement. So as we move them from risk evaluation all the way to kind of return to functional status after the procedure, are we asking the right questions along the way? Are there any gaps identified in care? So here are some example questions that you might be considering about each measure as you review. So does the measure address the right aspect of care for where patients typically are in their journey? This can be the right, are we asking this question in an appropriate setting, or is this something that would make much more sense in like an outpatient setting, for example? Does the measure still help identify gaps in care that may occur along the pathway? And then finally, would removing this measure, because we are focused on MSR, we can recommend a measure no longer be retained, which is a nicer way to say maybe the measure is considered for retirement. So would removing the measure leave an important part of the patient journey unmeasured? And or does another measure now better cover that point in care? So is there another way to get at this care point other than with this measure? So if you are going to suggest that a measure be not retained, is there anything else you think could fill that gap, or any considerations that we should have while looking for new measures from a rulemaking perspective? When I ask for this information, it's important that I remind you that this doesn't just go to Battelle and us nerds that enjoy reading your PyForm responses. It's also going to inform rulemaking, right? It gets written up in discussions. De-identified PyForms are something that CMS has access to as they move into rulemaking. I'll talk a little bit more about that moving forward. Next slide, please. Okay, so where we've been, we had 39, so up to 50. We had 39 measures that got these impact assessments, the PIAs. They were up for public comment. We got some great public comment that helped us narrow this down to 35 measures that we think offer really good window into current patient safety across CMS programs. Upcoming at the beginning of September, you guys will have access to our full preliminary evaluations, or preliminary assessments, excuse me, PAs, for these 35 measures, and they will include everything that was already in the PIAs. In addition to, we will have CMS provided rationale for measure inclusion in the CMS program. So CMS is going to provide us about a paragraph's worth of text as to why the measure remains relevant for the program. Or if it's a measure that maybe they're thinking of retiring, they'll let us know that as well. So kind of we're getting a window into CMS's thinking for a measure's current state in the program. We will also provide you with any considerations for statutorily required measure areas, meaning, there are some topic areas that you're required to cover in certain programs. And if a measure addresses one of those topic areas, we will let you know, because that presents some additional hurdles if the committee ultimately votes to not recommend retention. And we will also give you an insight into upcoming rulemaking. So for example, if CMS knows they might retire a measure or they're considering it, they'll give us that insight and we will pass it along to you. We also have a plain language evaluation of our 3 criteria. We've really worked this year to standardize our approach to have really accessible plain language evaluations across all of our criteria, and something that you can ideally review a measure in a lunch hour. That was kind of our hope, was that these could be bite-sized. And then we also have a discussion of any other relevant measures used within the program, MVP or specialty sets. So if this measure, the particular measure you're looking at in a preliminary assessment is part of an MVP, or it's part of other specialty sets, or has similar measures within the same program, we'll let you know that, because that relates to redundancy. Next slide, please. As we move forward, we will need information from you. This is your homework before the meeting. We are hoping to give you guys, I think we've scheduled about 3 weeks now for reviewing preliminary assessments and submitting your PyForms. It is important to note you will only be assigned about 4 to 5 measures to be kind of experts on to do the PyForms. We are, however, expecting you to be aware and able to discuss all of the measures as part of the committee. Okay. So PyForms will include plain language instructions. We ask you to please answer them based on the PAs and your personal and professional experience. For each criteria, you will just rate yes, no, whether you think it addresses the criteria, and then we give you a long free text box where you can put in all of your information. This year, we are doing this via the website. For those of you that were on the committee last year, I believe we have predominantly returning members. We soft launched this for primer due to the government shutdown and delays in the MUC list. Our PyForms were optional last year because we didn't want to, ruin your winter holidays by making you rush to do your PyForms. But this year we will be doing kind of a pilot of this for MSR. So at the end of our MSR cycle, there will be a survey. Please tell us about your PyForm experience. If you run into issues, you can always contact us at PQM support. It will help us respond to you more quickly if you put PyForm in the subject line, so we know to route it to the correct person, which would be me. But as you're working on this, please record your experience, take notes, let us, give us that feedback. We won't be upset if you have criticism. We want to make sure that this is a really effective tool for you to give your information to us, so that when we roll out for primer with a much larger group of committee members, we really have our system, down pat and ready to go. Next slide, please. And as a reminder, your PyForm responses will be viewable to your fellow committee members, but it's not viewable to the public. And we do have a handy dandy video that will explain how to do your PyForms, et cetera. It'll remind you of that. But I know it can be a little nerve-wracking when you're on the website right beside public comment and you're going to put in, your personal feelings about a measure. It's okay. Anything that goes back to the measure steward or CMS will be de-identified. No one will, track you down to your negative comments about a measure. Okay. Committee members are responsible for reviewing all of the PAs and for MSR measures and completing PyForms for their assigned ones. We're expecting PyForms to take about 20 minutes. PyForms are completed on the PQM website, like I said, and completed forms will be available to view and reference during the recommendations meeting. We worked with our IT folks to make sure that you can go back and view your answers again, as well as view the answers of your colleagues. So if there's a measure that you've been assigned, but maybe you're not a urologist or an ophthalmologist or something, you can kind of get some insights from your committee members. Next slide, please. Okay, and I'm only a little over my time. I'm going to hand that back over to Kate, but if you have any questions, feel free to email us or ask at the end. Thank you.
Thanks so much, Lydia. Okay, so our recommendation meeting will be October 13th, 14th, and half of October 15th. That being said, if we do end early, we may not need to take the 15th, but originally we had it scheduled as a backup meeting because we have so many measures to review. We are now making it part of the meeting with the option to drop if we are wildly efficient. The meeting is open to the public and all developers and stewards are strongly encouraged to attend. Next slide. So here we have our overall meeting process. I am going to go into more detail in the following slides, but this is a overall rundown of DOIs, summary of approach, measure review, feedback, and next steps. Next slide, please. So as people helpfully pointed out, our DOI link was not the correct one. We are going to have to resend. So we will do that in a follow-up communication. This is for the general DOI that applies both to MSR as well as to primer. So we're going to follow up in a communication with that so that we can get those general DOIs. We will also then do measure-specific DOIs, but there will be 2 coming from you. And yes, Nick, we will be sending calendar holds for those meetings with information. We also ask that people verbally disclose any relevant conflicts of interest. And if there is perceived or actual COI, Patel requires affected members to recuse themselves from voting on those applicable measures, but they can participate. Next slide. We are going to basically do what Lydia just did, which is going through our approach, evaluation, and then we will also be adding in the voting process. Next slide. And so the measure review, we will be providing an overview. CMS is going to give us some contextual background, why the measure is in the program. Then we are going to review the PA using the MSR criteria, public comment summaries, and Pi results. Committee discusses the measure, beginning with the patient participants, and then the committee votes on the measure. Next slide. We then do feedback because you'll notice for those who have served on MSR before or served with primer, we are constantly evolving and refining our process to ensure that it is most efficient and meets the needs. Our recommendations report and spreadsheet are both published on the website November 25th. This then prompts a second comment period. This does not impact the results of the recommendations, but it does allow CMS to get more data points. Next slide. So Patel staff works with our co-chairs to establish meeting ground rules and goals, keep discussion on track, prevent discussions from being dominated by a small number of participants, and ensure that decisions are reached. We use a simple majority for MSR, so it is different from primer. It is a simple greater than 50%. And then if we look on to the next slide, there are two options for voting outcomes. The committee can either recommend the measure should be continued in the designated CMS quality program, or recommend the measure should not be continued in the designated CMS quality program. Next slide. We look for two quorums. We want discussion quorum, which is that at least 60% of recommendation group members are at roll call at the beginning of the meeting. Then we're also looking for voting quorum, and that requires at least 80% of active recommendation group members who have not been recused from the specific measure. Next slide. It is extremely important that we keep quorum, and so we want to do everything we can to support you all on these meetings and your ability to participate. It is very important that we keep quorum throughout the days. Next slide. We, as I noted, put the report on our website, and it includes the committee recommendations and rationale. And then I want to note that one of the really important things we do is we take very detailed notes on where there are areas of maybe dissent or disagreement, or if a measure is especially a close, but you'll see that the rationales are pretty equally spread. So we want to really get the nuance of the discussions that you have. It's incredibly helpful for CMS. Next slide. Timeline. So there are a lot of questions about this in the chat, so I want to get on to it. We are currently in that blue August. We are developing the PAs, and then you'll be getting the PAs, and you'll be doing your PI forms. We'll be meeting in October. You may ask, when in October? So if we go on to the next slide, and these are just an overview of dates. Patient orientation is on August 10th. This summary is posted on September 4th. Our PI forms open and our PAs are posted on September 16th. But now to the really important information. What time do we need you all in October? So we need you all on October 13th and 14th from 10 a.m. to 5 p.m. Eastern Time, and October 15th from 10 a.m. to 1 p.m. Eastern Time. We are sending out those calendar holds later today, so you will have those on your calendar today. But the 13th and 14th are all-day meetings. The 15th is 3 hours, though if we are very efficient and quick, we won't need it. We do anticipate, though, that we do anticipate in the 15th because we always have such rich conversations. And then the publication of these spreadsheet and report, the 25th, and the second public comment period. Next slide. Okay, here we have some resources, and I am actually going to turn over to Meredith.
Thank you, Kate. And thank you to those of you who are putting in conflicts in the chat. We will do a review of sort of the potential impacts of those conflicts with other meetings on our own work. So stay tuned for any updates there. I'm going to do a little tour of our workspace, how to get there, what it's going to look like. So I'm going to share my screen in just a moment. And we'll put in some links in the chat so you can follow along. Just give me a minute here. Okay, just want to confirm, can you all see my screen? Yes, okay, great. So this is our website. This is the home page. And you'll see there's a tab at the top for measure set review specifically. This is where you will find the measures page that we've been talking about with the tabbed measure display. Here is sort of what the PAs will look like. They're not there yet. What you're seeing now are the PAs, but just to give you a preview, again, of what the tabbed measure display looks like. So you'll be navigating through the information on these tabs, and you will also be able to complete your PI form on a separate tab once the PAs are live. So I really wanted to talk about the workspace today. It's something we've been sort of evolving over the past couple of years, and we're continuing to make enhancements and improvements so that it's not only just like a place where you can use the discussion board to communicate with one another. We're also building it out so it's sort of like your one-stop shop for resources and for information as well. So let me go back to the home page here for a second. Okay, so you can get to the workspace in a couple of ways. You can click this committee login. You can also get there from this Access Measure Workspace button. I like to go up here. I don't know why. That's my preference to use that upper right-hand corner. But this is a committee only space. If you do not already have an account, you will need to create one so that we can grant you access as an MSR committee member to the right resources. So there's a button right here to create an account. Please do take some time to create an account if you don't already have one. It will take us a couple of days to provide you the correct permissions so that you can get to the MSR resources. But the first step is creating that account. If you already have an account, you can log in here. So I will go ahead and do so. And then I have this math question to make sure I'm not a robot. And I'm going to click login. And hopefully I did that math right. That was a nice, easy one for me. Okay. So you can see there's some links on the left. We will be maintaining our discussion board feature, so you will be able to send messages to each other if you are sort of reviewing your PI form, want to share, an article that might be of interest to your fellow committee members, et cetera. You're welcome to post. We can also sort of broadcast information using our PQM posts. And one thing I wanted to highlight here is that we are adding a sort of bulletin news box on this landing page. So after the end of this week, when you log in, you will see a button that will launch a PDF that is essentially like your syllabus for what's happening for the next few months. So we're going to be updating that document as the weeks move on. So you'll always have sort of like, what's the latest and greatest news? What do you need to pay attention to? And that will be front and center when you log in and go to your home page within the workspace. You will also have linked within your workspace the measures that are up for review in MSR. You'll have links right to the tabbed measure display so you can complete your PI form. So again, we want this to be a useful resource for you. As Lydia mentioned, we do welcome, we love your feedback. We workspace and what was most useful to you at the end of this cycle. So please do connect with us around your experience with the workspace. And we do, continue to make improvements, and we hope that it is useful to you. Let me stop sharing my screen here. And we'll head back to the slide deck. Great. Okay. So before I get into next steps, any questions about anything we've covered so far? All right. So we have a couple of next steps. We will be resending the DOI form. Thank you all for your patience and for alerting us that you were able to edit that form. So we're just going to take a moment to make sure it's as clean as possible, and we will go ahead and resend that in a communication following this message. We will be sending out your PI form assignments. So the 4 to 5 measures that you'll be assigned to review, those are coming to you on September 16th. And those are going to be accompanied by the measure-specific disclosure of interest forms. We're going to ask you to complete those PI forms and those measure-specific DOIs by September 29th. And then we have our committee meeting currently scheduled for October 13th through 15th. In the meantime, we also have a meeting just for our patient partners on the committee for another chance to sort of dig into this material, ask any questions, and also to talk about some patient-specific considerations for participation in MSR. And we can move to the next slide. So we're open to your questions or comments now. You can also contact us through our website. There's a little contact us bubble, and you can email us at pqmsupport@battelle.org. So if anyone has any questions or comments, now is a great time to ask. I'll do a quick check to make sure I haven't missed any raised hands. And I see, Mary Ellen, we'll follow up with you offline on your issue. There are several ways to engage with PQM as an organization. So just want to make sure we understand, how you've been communicating and what your goal is so that we can fix whatever web-based issue you're facing. So I'll follow up with you after this meeting. Thank you for raising that. Okay, Mary Ellen, we are going to send the DOI form in a separate meeting after, and in a separate email after this meeting. We need to just make sure that it's no longer editable and that it looks good. We will recirculate after this call. All right. Well, it was just wonderful to see you all. We really appreciate your time. I hope that you have a wonderful rest of the summer, and we will be in touch soon. So thanks so much, everybody.